Welcome to News West 9's West Texas View with Johnny Lou Avery.
Good morning and welcome to West Texas View. I'm Joni Hires, filling in for Johnny Lou Avery this morning, and we are honored to have back again this week Dr. Joy Anderson, and she is a OB-GYN doctor at Texas Tech Health Science Center in Odessa, and she was talking last week about some issues. We ended the show last week with her talking about some differences between the cancers, hereditary cancers and environmental cancers, and so we're going to kind of pick up where we left off last week and visit with her this morning a little bit more about the hereditary cancers. So welcome back, Dr. Anderson, and kind of fill us in and help us pick back up to speed where we were on the hereditary cancers.
We were talking, thank you again for having me, by the way.
Sure.
We were talking about the difference between genetic cancers because a lot of times patients come in with the misconception that every cancer is a genetic cancer, but a lot of times it's just environmental. And we're learning even about, I'm not a male doctor, but for prostate cancer, you know, if you live to be 70, you're going to have prostate cancer. And so do we want to be treating these guys with all these problems? Problems from the chemo and radiation, problems from treatment. And so there's a downside with breast cancer too on that, and we talked a little bit about that last time, but the majority of cancers are environmental situations, not hereditary. People always come in asking for testing when that may not be the best thing for them.
That's great to know. And so just to recap, what are some of the environmental factors that play most into some of these cancers?
Smoking is always one. Obesity is always going to be one. Alcohol use, depending on the cancer, there's actually some cancers that are much more alcohol and smoking together. But for female cancers, a lot of it has to do with lack of contraception use. So contraceptives, birth control pills, are actually protective against ovarian and uterine cancer, and that's a misconception people have. They think that birth control causes cancer or causes complications. I'll tell you, if somebody's got a genetic cancer risk, I'm going to put her on the pill. That's going to be the first thing I'm going to do, and then we're going to have a conversation about when you're going to have your kids and what we're going to do to prevent these cancers. But 5 years of birth control pills cut the risk of ovarian and uterine cancer by at least 40 to 50%.
On anybody?
Yes, on any woman, yes.
That's
so
wonderful.
it's a huge thing. It doesn't affect breast cancer plus or minus, and it doesn't affect cervical cancer because that's more an environmental thing too. Cervical cancer is more smoking and not getting care. Cervical cancer takes 10 years from the time that you get HPV, which is the virus that causes it, to cause the cancer. So we have a huge amount of time in there to pick up a cervical dysplasia, which is why the pap smear guidelines have changed to every 3 years from starting at the age of 21, which is a very important thing I want to bring up too.
Yeah, please re-emphasize that.
You don't need a pap smear every year,
that's
which
very
is
important.
wonderful. Every 3 years is the guidelines. We start at 21 no matter when you've started having sex. We're also very much laid back about what we do about abnormal pap smears now. It used to be that we'd start shaving off parts of your cervix when you were 21 or 22. Now we follow a lot of things. There are some things that we treat and some things that we leave alone because we find that majority of these changes that we see on an abnormal pap will go away if we leave you alone until you quit smoking, come back in a year. So our guidelines have become a lot more lax. We also recommend if you've always had normal paps, stop at 65 because you've already got the virus called HPV, which is the virus that causes 70 to 90% of cervical cancer that we know of. And that's something that you've already been exposed to and your body fought off and cleared. Which also brings to the next subject, HPV vaccination. I'll just kind of go into that briefly. We recommend getting it at the age of 11. You can start it as early as 9, but there is no harm that can come from this vaccine. There's nothing you can get from the vaccine. The word on the street from the teenagers is that it hurts a little bit more, but let me tell them what I do when they start getting cervical dysplasia. That hurts a lot more.
Oh, I can imagine.
3 shots versus shaving off part of your cervix with no anesthesia. I think I'll take the shots, thank you very much. I suspect too that when the HPV vaccine's been out for a long time that the guidelines on pap smears are going to change for the women that are vaccinated.
Vaccinated, right. So are you seeing, I know it's still kind of a new concept for a lot of people, especially the parents, but are you seeing an uptake on women who are taking advantage of getting the HPV vaccine? You
know, what I'm seeing is women that are educated in their 20s when it's too late. HPV spread by close contact, and so 100% of healthcare workers have it. We have it by touching our patients, and it's not just something you catch from having sex. So there's a lot of misconceptions about it, and they think of it as a sexually transmitted infection. You know, so is influenza. If you have sex with somebody with the flu, you know, that's sexually transmitted too. It's close contact more than anything else. And so, you know, you can say as much as you want to, my daughter's going to be a virgin until she's 30, but the reality of it is you need to get her for a few years before there's a chance that she's even going to make out with anybody. And that's pretty young nowadays. So I really would recommend getting it 11.
Well, and like you said, it's not an STD.
Right.
It is just a close contact disease,
right.
and there is a difference.
If she's going to join the nunnery and work with taking care of patients as a nun, great, get her the HPV vaccine because she's going to catch HPV that way.
Right.
So, you know, however they get it, it doesn't matter, get the vaccine. There's really not any harm to it, and you can't catch HPV from the vaccination.
So have they started recommending that be given?
Yes.
Has it already been recommended?
Yes, starting at age 11. You can get it as early as 9, and you can get it as late as the age of 26. But like I said, most people by the time they turn 26 have already gotten exposed to HPV. So, and it takes years to do the damage that it does. So once somebody has an abnormal pap smear, it's too late. They've got that strain of HPV. It's really too late. So my plan for my 2- and 4-year-old is to vaccinate them the second they turn 11, both of them, and my son too.
I was just about to say, so it's not just a female thing.
Well, it does cause penile cancer, which is more common in boys that are not circumcised. Beyond just genital warts, the ones that cause cancer are not the ones that cause warts. And so people think of this as the wart vaccine. You know, bring a wart to me, I'll burn it off, I can cut it off, it's no big deal. It's the cancer that we worry about. Plus it causes head and neck cancers, a lot of head and neck cancers. And so, you know, we're probably vaccinating against throat cancer too. And so one of the things that bothers me about presenting this as an HPV vaccine and an STD vaccine is that parents are going to hear we're vaccinating against something that happens from sex. You know, if I told you we have a vaccine for throat cancer, don't you think you'd get it?
Yeah.
And that's what this is too.
Yeah. So is it widely acknowledged that it is also beneficial for boys, or has it not really been put out there yet?
I'm a gynecologist, so I'm going to see the women, you know,
Right.
But I'm absolutely going to vaccinate my son. I'm not a second thought, and I would recommend. I'm sure the pediatricians are recommending giving it to boys
That's
too.
great.
Yes,
and you're right. The misconception is what is driving a lot of the paranoia right now.
Absolutely.
Is they're considering it as a sexually transmitted disease and all the things that go with that, and aren't considering what else, the complications that come with it. So
yes,
that's great. Well, so back then to the pap smear, the new guidelines on the pap smears. When a woman, this is kind of contradictory, first of all, to what we're used to, and second of all, what like the mammograms in the past increase with age, and now you're saying that it will stay steady and then at some point just quit. So is that? I mean, that's
with pap smears, yes. And the thing is, it takes 10 years to develop. Even if you get a very bad version of HPV, which we all get when we're in our teens and 20s. It takes 10 years to form cancer. And so let's say you're 75 years old, you know, that's not the average life expectancy. I personally plan to die around 82. That's when every woman in my family dies. So I think I'm going to stop getting PAPs at least 15 years before that. So it really is a matter of what's going to be the most likely cause of death. And I hate to be cynical about it, but that really is how we think about things.
I understand. We're going to take a quick break, and we'll be back to talk some more about these fascinating new guidelines for women's health care, and along with a lot more. So please join us in a few minutes.
Stay tuned. West Texas View will be right back.